The emergency department of St. Matthew's Medical Center never truly slept. Even at 2:17 a.m., fluorescent lights hummed over polished floors, monitors blinked in steady rhythms, and the air carried the layered scent of antiseptic and fatigue. Daniel Reyes stood at the nurse's station finishing documentation with careful, deliberate handwriting. His badge still looked too new. RN, Emergency Services. It had been 3 weeks since his transfer, 3 weeks of polite nods, measured smiles, and being assigned the lower acuity cases while the senior staff handled trauma alerts. He did not argue. He did not ask for more. He simply watched. He noticed how the automatic doors hesitated half a second before fully opening. He noticed that the crash cart near Trauma Bay 3 was missing a sealed airway kit. He noticed that security response time, based on the last 2 disturbances, averaged just over 90 seconds. None of this was written down. He carried it quietly. Across from him, charge nurse Valerie Kim reviewed the incoming board. She had 20 years in emergency medicine and the reflexes of someone who had seen everything twice. She glanced at Daniel briefly. "You'll take bed 5. Dehydration, simple." He nodded once. "Yes, ma'am." No hesitation, no disappointment, just acknowledgement. A paramedic crew burst through the ambulance entrance moments later, their boots heavy against tile. The patient they wheeled in was restrained at the wrists. A police officer followed close behind, jaw set tight. "Male 32, the paramedic reported. Altercation outside a bar, possible head injury, combative on scene." The patient's eyes moved too quickly, scanning faces, ceilings, exits. Daniel watched the pattern, not confused, not disoriented, calculating. The man's breathing was elevated, but controlled between outbursts, adrenaline without loss of awareness. That detail settled somewhere in Daniel's mind. "Put him in Trauma 3, Valerie ordered. The officer removed one wrist restraint reluctantly. "He's been unpredictable," the officer warned. "Strong." Daniel stepped aside as they transferred the patient. He said nothing, but he observed how the man tested each strap the moment staff turned their backs. Not panicked thrashing, measured pressure, testing tensile strength. A resident physician approached with sedation orders already in hand. "Likely intoxicated," the resident muttered. "We'll calm him down." Daniel's eyes flicked to the patient's shoulders. Tension stored there. Weight forward on the balls of his feet, even while seated. The IV placement required 3 staff members to stabilize him. The patient smiled once during the process. Not friendly. Evaluating. When the police officer stepped out to take a call, Daniel shifted half a step closer to the doorway without appearing to do so. He positioned the rolling stool subtly out of the patient's immediate reach. He adjusted the heart monitor cable so it would not tangle around anyone's ankles. Small movements. Invisible corrections. "You're awfully quiet," one of the nurses whispered to him later as they restocked gloves. "You don't talk much." Daniel gave a small nod. Still learning the department. It was technically true. He was learning the department's rhythms, the blind spots, the overconfidence that sometimes grew in familiar chaos. Back in Trauma 3, the patient's agitation escalated in controlled waves. He cursed. He spat near a technician's shoes. But between outbursts he was watching, Daniel noticed the man's pupils were not consistent with heavy intoxication. His coordination when he reached for the bed rail was precise. Too precise. "Sedation's taking longer than usual," the resident said, frowning at the monitor. Daniel checked the IV line. Patent. No infiltration. The dosage was correct. The patient's muscles, however, remained coiled beneath the hospital gown. Daniel felt something shift in the room. Not dramatic, not loud, just an imbalance. He looked at the security camera dome in the corner. 1 guard tonight, covering the entire wing. He calculated the hallway distance again without appearing to. Valerie stepped in briefly. "Everything stable?" she asked. The patient answered before anyone else could. "I'm perfectly stable," he said, voice lower now. Controlled. That was the moment Daniel's posture changed by a fraction. Not defensive, not aggressive, just ready. He rested one hand lightly against the edge of the bed rail, testing its stability as if absent-mindedly. He adjusted his stance so his weight was evenly distributed. No one noticed. Why would they? He was the rookie. the quiet transfer nurse who took dehydration cases and stayed late to finish charting. But his eyes never left the patient's shoulders, and when the man's breathing slowed, not from sedation, but from decision, Daniel understood something the others had not yet seen. The eruption was coming. It would not be confusion. It would be deliberate. He did not announce it. He did not raise alarm. He simply moved half a step closer to where the violence would begin, and waited. The shift changed subtly at 2:26 a.m. The monitors continued their steady beeping, but the tone in Trauma Bay 3 tightened. The patient's breathing evened out in a way that did not match sedation. It was controlled, deliberate, like someone lowering their center of gravity before lifting something heavy. The resident leaned over to check pupil response. "You're going to feel sleepy," she said calmly. The patient's eyes fixed on her face, then flicked past her shoulder toward the open doorway. Daniel saw the calculation happen. It was not panic. It was timing. The patient's left hand relaxed first. His right shoulder rolled once, subtly testing range of motion. Daniel stepped to the side of the bed without drawing attention, placing himself between the patient and the corridor while appearing to check the IV line. "Sir, we need you to stay still," Valerie said firmly from the foot of the bed. The patient smiled again, that thin, rehearsed expression that did not reach his eyes. "I am still," he replied. The IV pole moved before anyone processed the motion. He yanked it free with one violent twist, metal screeching against tile as the base skidded. The heart monitor cable snapped from its clip. The resident stumbled backward. A tray of syringes crashed to the floor. Sound filled the room, sharp, metallic, sudden. The patient came off the bed with startling coordination, not the disoriented stumble of intoxication, but a forward drive, weight balanced, grip tight on the IV pole like a staff. He swung once in a wide arc. It forced Valerie to retreat toward the medication cart. A technician froze near the wall. "Security!" someone shouted down the hallway. The patient pivoted toward the doorway. That was the real target, not the staff, the exit. Daniel saw it clearly now. The man's strikes were not wild, they were creating space. The IV pole came down again, clipping the edge of a supply cart and sending gauze packets across the floor. Daniel did not rush him. He adjusted his position, angling his body 45 degrees, hands open and relaxed at chest height. His voice was level. "Stop!" It was not loud. It was not emotional. The patient charged. There was no warning scream, no dramatic declaration, just a sudden forward burst, shoulder lowered, pole angled to strike. Daniel stepped inside the arc instead of away from it. His left hand intercepted the patient's wrist at the moment of extension, not grabbing, but redirecting. The IV pole's momentum carried past his shoulder. His right hand rose under the patient's elbow, lifting and rotating at the joint. The movement was small and exact, the kind of motion practiced hundreds of times until it required no thought. The patient's balance broke immediately. His forward drive turned into downward collapse as Daniel shifted his own weight, guiding rather than slamming. The man hit the floor chest first, the IV pole clattering away. Daniel's knee settled against the patient's shoulder blade, not crushing, just anchoring. His hand controlled the wrist at an angle that eliminated leverage without snapping the joint. "Breathe," Daniel said quietly. The patient tried to twist, but each movement only tightened the geometry of the hold. There was no striking, no visible rage, just structure. Security guards burst in seconds later, out of breath, batons half raised. They stopped when they saw the scene. The patient was immobilized, pinned by positioning rather than force. Daniel did not look at them. "Restraints," he said evenly. One guard knelt to assist. Even cuffing the man required coordination. The patient still had strength, but it had nowhere to apply. When the final restraint clicked into place, Daniel released pressure gradually, maintaining control until others had full contact. He stood only after confirming the man's hips and shoulders were secured. The entire altercation had lasted less than 6 seconds. Equipment lay scattered, the heart monitor dangled by a single wire. Valerie's hands trembled as she steadied the medication cart. The resident stared at Daniel as if recalibrating what she thought she knew. Daniel adjusted his scrubs at the sleeve where the patient had gripped fabric. A faint bruise was already forming along his forearm. He ignored it. "Is anyone injured?" he asked, scanning the room before scanning himself. His breathing was normal, not elevated, not rushed. The patient glared up from the floor, anger shifting into something else. Recognition. He tested the restraint once more and then stopped. Daniel stepped back, giving space now that control was established. He retrieved the IV pole from the corner and set it upright against the wall. He picked up the fallen tray and placed it on a clean surface. The routine gestures felt almost inappropriate against the adrenaline still vibrating in the air. Security escorted the restrained patient toward a secure holding room for reassessment. As they passed, one guard muttered quietly, "Where did you learn that?" Daniel did not answer. He was already checking the resident's shoulder where she had stumbled. "You're not dislocated," he said calmly, "just shaken." Valerie approached him slowly. She had seen bar fights spill into the ER before. She had seen security tackle patients. She had never seen a single nurse neutralize a charging adult male without throwing a punch. "You okay?" she asked. Daniel met her eyes. "Yes." No pride, no performance, just fact. The corridor noise returned gradually. A new ambulance radioed in a cardiac alert. The department could not pause for long, but something fundamental had shifted. Not the crisis. That had been contained. What changed was how everyone in that room now looked at the quiet rookie nurse. And Daniel felt it. The attention, the unasked questions, settling on him heavier than the struggle itself. The noise faded, but the room did not feel the same. Trauma Bay 3 carried the residue of force. Overturned instruments, a cracked plastic monitor casing, a faint smear of blood where the IV had torn loose. Daniel moved through the space methodically, restoring order piece by piece. He replaced the heart monitor leads, disposed of contaminated supplies, and documented the incident in clear clinical language. No embellishment, no defense, just sequence and mechanics. Patient initiated forward assault with improvised object, applied joint stabilization and positional restraint, awaited security transfer. He reread it once before submitting. Across the hall, the restrained patient continued to shout threats from the secure room. The words were loud, but the energy behind them had shifted. The earlier aggression had been strategic. Now it was frustration. Daniel washed his hands slowly at the sink, eyes lowered, replaying the 6 seconds in his mind. Not with pride, with assessment. The angle of entry had been correct. The rotation had been efficient, but he had allowed the IV pole to swing within 2 inches of Valerie's shoulder. That margin would need tightening next time. Next time. The thought lingered without emotion. Valerie stepped beside him. "You didn't hesitate," she said quietly. It was not an accusation. Daniel dried his hands. He committed his weight forward. Once he did that, he couldn't recover. His explanation was anatomical, not heroic. She studied him for a long moment. That wasn't basic self-defense training. Daniel met her gaze without flinching. No. That was all he offered. Down the corridor, hospital administration began to gather near the nurses' station. An incident of this magnitude required reports, witness statements, procedural review. Daniel could already feel the bureaucratic gravity forming. He did not resist it. He understood systems. In the secure holding room, the patient attempted another surge against the restraints. Security called for medical reassessment. Daniel volunteered without raising his voice. "I'll evaluate him." The guard hesitated. "You sure?" Daniel nodded once. Inside the room, the patient's eyes locked onto him immediately. Recognition sharpened there, not of identity, but of capability. "You think you're tough?" The man spat. Daniel ignored the provocation. He checked circulation in the restrained wrists, ensuring the cuffs were not cutting blood flow. He adjusted the positioning slightly to prevent nerve compression. Even restrained, the patient's muscles remained coiled. Daniel kept his distance measured, outside immediate striking range, even with limited mobility. "Your shoulder will stiffen if you keep fighting the angle," Daniel said calmly. "Relax it." The patient glared, but did not respond. Daniel's movements were efficient, economical, no wasted gestures. The guard, watching from the corner, shifted uncomfortably. "You military?" he asked suddenly. The question hung in the air. Daniel did not look at him. "I'm a nurse," he replied. Technically true. Outside the room, a man in a dark suit stood speaking with Valerie. He was not regular hospital staff. His posture was too upright, his gaze too observant. Daniel noticed him the moment he stepped back into the corridor. The man's eyes lingered briefly on Daniel's hands, specifically the way he flexed his fingers once, resetting tendons after sustained grip pressure. A small habit. Not many people would recognize it. This man did. That control technique, the suited man said later, voice low as Daniel passed. Not common. Daniel paused only a fraction of a second. It prevents injury, he answered. Nothing more. The cardiac alert arrived minutes later, pulling staff into immediate life-saving focus. Daniel transitioned seamlessly, assisting with compressions, adjusting oxygen flow, calling out vitals with steady cadence. There was no trace of the earlier confrontation in his demeanor. His pulse remained controlled. His voice never rose. Competence was not an event for him. It was a baseline. Yet whispers traveled through the department. Did you see how he moved? He dropped him instantly. Security didn't even touch him. Daniel heard fragments without reacting. Attention was uncomfortable. Attention led to questions. Questions led backward. He preferred forward motion. After the cardiac patient stabilized and transferred to ICU, the department experienced a rare pocket of quiet. Daniel stepped into the supply room alone. He closed the door halfway. Not fully. Never fully. He flexed his bruised forearm again, testing range of motion. Mild strain. Nothing significant. He inhaled slowly, then exhaled through his nose, allowing the residual adrenaline to dissipate. No trembling, no rush, just a controlled descent back to equilibrium. In the hallway, Valerie watched him through the narrow window in the door. Not suspicious, observing. She had seen panic masked as calm before. This was different. This was trained composure. When Daniel returned to the station, the suited man was gone. Administration had retreated to conference rooms. Security had filed preliminary reports. The patient remained restrained, subdued now by both cuffs and reality. Daniel resumed routine tasks, restocking saline, checking expiration dates, assisting a child with a fever in bed 5. The mother there thanked him softly for his patience. He nodded once. No mention of what had happened 30 feet away less than an hour earlier. But beneath the fluorescent lights, beneath the paperwork, and the steady beeping monitors, something irreversible had occurred. The department had seen precision where they expected inexperience. And Daniel understood that the real shift was not physical, it was perceptual. They would look at him differently now, and that attention would carry its own weight. The man's expression did not change, but something in it confirmed understanding. He did not press further. Back at the nurse's station, the resident approached Daniel hesitantly. "You could have broken his arm," she said. "You didn't." Daniel logged medication updates into the system. He didn't need a broken arm. It was not mercy spoken loudly. It was simply policy in his mind, force applied only to the level required to end threat. By 4:10 a.m., the emergency department had stabilized, but the administrative machinery had not. Daniel sat in a small consultation room beside the charge desk, hands folded loosely on the table, posture straight but not rigid. Across from him sat the nursing supervisor, a risk management officer, and the same suited man who had observed him earlier. The patient remained in restraints, pending psychiatric evaluation and toxicology results. The official language being prepared would determine whether the hospital framed the incident as necessary force or excessive response. Daniel understood the weight of wording. "Walk us through exactly what you did," the risk officer said, pen poised above a legal pad. Daniel did not dramatize. He described joint alignment, redirection of momentum, stabilization of the scapula to prevent rotational leverage. He clarified that he avoided cervical pressure and airway compression. He stated that no strikes were delivered. His tone remained even, clinical. When asked why he acted before security arrived, he answered simply, "There was imminent risk to staff and unsecured patients in the corridor." No more, no less. The supervisor exchanged a glance with the suited man. "You are not assigned as primary on that case," she noted. "Correct," Daniel said. "But I was present." Silence settled briefly. The suited man leaned back slightly, studying him. "Those techniques," he said carefully, "are not part of standard hospital de-escalation modules." Daniel met his eyes without challenge. "No." Another pause. The supervisor cleared her throat. "Do you have prior law enforcement or military background we should be aware of?" The question was direct but professionally phrased. Daniel did not look away. "Yes." He did not elaborate. The room waited. He added only what was necessary. "Former combat medic, attached to a specialized unit. My role was medical stabilization and close protection support." The words were controlled, stripped of detail. He did not name the unit. He did not reference deployments. He offered no medals, no history of operations, just function. The suited man's gaze sharpened almost imperceptibly. Recognition flickered there, not from gossip, but from shared vocabulary. "That explains the restraint geometry," he said quietly. Daniel gave a small nod. "It prevents escalation." The risk officer tapped his pen once. "The patient claims you assaulted him." Daniel absorbed that without visible reaction. "He initiated physical aggression with a metal object. My response ended the threat with minimal injury." He paused briefly. "His shoulder may experience temporary strain. I adjusted positioning to reduce risk of long-term damage." There was no defensiveness in his tone, only record. The supervisor folded her hands. "You understand the optics. A newly transferred nurse applying advanced force. It raises questions." Daniel accepted that. Understood. He did not argue. He did not justify beyond fact. Outside the consultation room, the department continued its slow pulse. Inside, the atmosphere thickened. "If this becomes legal," the risk officer said, "we may need documentation of your prior training." Daniel inclined his head. "I can provide service verification through appropriate channels." He did not mention classification. He did not mention that much of what he had done overseas never existed on paper. The suited man stood first. "I believe the nurse's actions were proportionate and prevented greater liability," he said calmly. His tone carried quiet authority. The supervisor seemed relieved to anchor to that assessment. The meeting adjourned without accusation, but not without consequence. Daniel stepped back into the corridor, aware that his anonymity had narrowed. Valerie waited near the station. "You could have let security handle it," she said softly, not accusing. Searching. Daniel looked down the hall where a pediatric patient laughed faintly from behind a curtain. "They were too far," he answered. "Someone would have been hurt." Valerie studied him for a long moment. "You didn't enjoy it." It was an observation, not a question. Daniel shook his head once. "No." He walked toward the break room briefly, leaning against the counter when no one was looking. The bruise along his forearm had darkened. He pressed it once, testing sensation. Pain grounded him. It reminded him that restraint always carried cost, even when measured. Not physical cost alone. Exposure carried weight. In the secure room, the patient had grown quieter. Toxicology would later confirm stimulant presence, explaining part of the volatility, but not the calculated aggression Daniel had sensed. As he updated the chart, Daniel considered the thin line he had walked. Too much force would have shattered bone. Too little would have allowed a weapon into the hallway. The balance had been exact. That precision was not accidental. It had been forged elsewhere, in environments far less forgiving than fluorescent hospital corridors. The suited man approached him one final time before leaving. "You kept your unit habits contained," he said in a low voice. "That matters." Daniel met his gaze steadily. "This is a hospital." The man nodded once, understanding layered within the simple exchange. No handshake followed, no overt acknowledgement, just mutual recognition and departure. As dawn approached, the sky outside the ambulance bay lightened a pale gray. Daniel resumed ordinary tasks. Checking medication counts, assisting with discharge paperwork, restocking trauma supplies. Staff now gave him a fraction more space when passing. Not fear. Respect edged with caution. He did not seek it. He did not reject it. He carried it the same way he carried everything else, quietly. The cost of control was not paperwork or bruises. It was visibility. And Daniel understood that visibility was a currency he had spent carefully for years. Tonight, he had spent some again. Morning light filtered through the high windows of the emergency department, washing the harsh fluorescent glow into something softer but no less revealing. The night staff prepared for handoff, voices lower now, fatigue settling into shoulders and eyes. Trauma bay. 3 had been reset completely. Fresh linen stretched tight across the bed. New monitor leads coiled neatly. No trace remained of overturned equipment or scattered syringes. Only the incident report in the system marked that anything had happened. Daniel stood at the nurse's station finishing his final chart entries. His handwriting remained steady. No flourish. No emphasis. Just sequence and fact. The hostile patient had been transferred to a secured medical floor under observation after psychiatric consult. Minor shoulder strain. No fractures, no concussion, controlled outcome. Valerie approached with the day shift charge nurse. "This is Daniel," she said evenly. "He'll brief you on Trauma 3. The introduction was ordinary, but the tone carried weight. Daniel summarized the event in concise terms, outlining the timeline, the patient's behavioral cues, and the necessity of restraint. He avoided adjectives. He avoided self-reference. When he finished, the day shift nurse studied him for a moment. "Good containment," she said simply. Daniel nodded once. "We were fortunate." He did not correct her. He did not accept praise. He reframed it as circumstance. As staff dispersed, one of the security guards lingered near the desk. "If you ever wanted to show us that hold," he said quietly, almost hesitant, "it could help." Daniel considered the request. He did not dismiss it, but he shook his head slightly. "Best technique is prevention," he replied. "Positioning, awareness." The guard absorbed that, recognizing it was not refusal out of ego, but out of principle. Daniel removed his badge and clipped it to the inside pocket of his jacket. In the locker room, he changed out of scrubs slowly, folding them with care. The bruise on his forearm had deepened to a muted purple. He flexed his fingers once more, confirming full function. The mirror reflected an unremarkable face. Tired, composed, anonymous. No sign of the geometry that had unfolded hours earlier. In the hallway outside, the suited man from administration stood speaking with hospital leadership. As Daniel passed, their eyes met briefly. There was no nod this time, no acknowledgement at all. That was the acknowledgement. Confidential understanding preserved by silence. Daniel continued toward the employee exit. The automatic doors opened with their familiar half-second delay. Morning air carried a cool edge as he stepped outside. Ambulances lined the bay, engines idling. Another shift of crises already forming. Behind him, inside the department, life moved forward without ceremony. No announcement would be made about what had occurred. No commendation would appear in a newsletter. The narrative would remain clinical. Incident resolved without major injury. That was enough. Daniel paused briefly near the edge of the parking lot, watching the sky brighten from gray to pale gold. The hospital windows reflected the new light, giving no hint of the violence contained within them hours earlier. He felt the familiar weight settle back into place. Not burden, not pride, just responsibility carried forward. He had stepped in because stepping back would have cost more. Nothing about that required applause. His phone vibrated once with a message from an unknown number. "Heard you handled yourself well." No signature. Daniel read it, then deleted it without response. Past and present did not need to merge. He slid the phone into his pocket and walked toward his car. Inside the emergency department, Valerie began the day shift briefing. She did not dramatize the event. She did not elevate his name. But when she assigned trauma coverage for the next incoming critical case, she wrote Daniel Reyes on the board for the following night's lead position. Quiet adjustment, earned trust. No speech accompanied it. As Daniel started his engine, he glanced once more at the hospital entrance. Another ambulance pulled in. Another set of doors opened. Another moment of instability waiting for someone to stand steady. He drove away without looking back again. The department would continue. The patients would continue. And when needed, he would return. Still the rookie nurse on paper, still underestimated at first glance, carrying authority that required no uniform to exist.